The demographics of our nation are changing rapidly, and consequently, so are the healthcare needs. To meet the demand, a healthcare workforce with diverse skill sets and new types of training is needed. The Williamsburg Health Foundation is pleased to honor programs and people helping to evolve the healthcare workforce landscape so that it will meet our community's needs into the future. Dr. Carl and Mrs. Ethelyn Gibson are honored for their volunteer leadership of the Medical Explorers Post 757. In collaboration with community organizations, the program has introduced over 50 local youth to healthcare careers, and it continues to grow.
When I was trying to decide what I wanted to be when I was in high school, I wish that I'd had a program like this to be able to come and really see, do I want to be a nurse? Because all I knew was nurses and doctors. I didn't know all the other things in the hospital. So for me, I think it's important that we can serve the students.
They sought me out and I helped recruit kids and kind of get the program started with the youth involved. And they already had volunteers ready to step up and people in mind to get the program started for adult leadership.
We talked to a couple of banks and we got one to sign on with us. We talked with the Williamsburg Health Foundation, and everybody we talked to said yes. It was one of the most extraordinary experiences that, frankly, I've had.
People that work in healthcare are really enthusiastic about what they do, and I think I enjoy the opportunity to have students engage with those individuals so that they can see and hear why they do and love what they do.
Most of the hands-on experience that I gained made me want to come back another year, because not only did they just talk to us about what each profession does, they actually showed us and had us participate in any field they let us have through the curriculum.
It's given me a lot of faith in myself and a lot of courage that I didn't have at first.
To have an impact on someone, a young person's life, I think is a blessing, and if you are able to do that.
The key thing to any organization is leadership, and they have provided the leadership for this organization, and it has been extraordinarily well done. The community has gained a good deal, I believe, from this Explorers organization, and a lot of that is due to the fact that it has had superb leadership.
Thomas Nelson Community College is honored for its Health Professionals Division, which plays a critical role in ensuring our community has a well-trained healthcare workforce. The dental hygiene and nursing programs have a strong focus on community service.
A very important part of our mission is to prepare students for productive careers that are needed in our community. And the health professions are, of course, one of those vital areas. So we regard our nursing program, our dental hygiene program, the certified nurse aide program that we've started in the last 2 years here at the historic Triangle campus. We regard each of those programs as providing important professionals to serve the healthcare needs of the community.
There's also a shortage of oral health professionals who can treat those who don't have the money to pay for the dental care. And so it's important for us to see ourselves in not only helping the individual, but helping the communities, and especially those who have lack of access to care.
Nurse aides are extremely important. They're our eyes in our facilities because they see the patients all the time. A lot of times the nurses are there giving treatments and giving medications and taking care of emergencies, putting out fires, but the certified nurse aides are there seeing everything and doing everything for the patient.
Well, we're very proud of the resources that we have here at the historic Triangle campus for both our nursing and our dental hygiene program. A recent addition to the nursing program is a simulation, what we call Sim Mom, of a mannequin that does all sorts of things, computer controlled. that allows for OB and GYN simulations to occur.
Students start off, we call it competency education, and what that means is that we teach them the knowledge, skills, and values to help them to become a competent dental hygienist ready for employment. Part of that education starts off not only in didactic lectures, but also in simulation. And we have a simulation lab where the students are able to practice instrumentation and learning the skills needed to be a dental hygienist.
We have one of the nicest clinics, I think, I've ever been into. We have film x-rays, we have digital x-rays, we have brand new instruments, the newest instruments that are made.
We also stress that in addition to our students preparing for productive careers, we want them to be contributing members of society. We want them to give back because they've been the beneficiaries of higher education. We want them to do that, and the students in our nursing, dental hygiene programs are known for their active participation in various community events.
The wonderful thing that happens here at the historic Triangle campus is that we have a full facility, 11 dental units, chairs, that we're able to serve not only education for our students, but people of the community who have access to care needs.
Many didn't qualify for any type of assistance, so they didn't usually have dental insurance. Many patients didn't even speak English, so we'd have to have a lot of translators come in and help us communicate with our patients. But they were so gracious of our services, and it was an irreplaceable experience to be able to work with patients like that.
As far as the staff, I think they're really grateful to have that extra hand, and we're all eager to learn and excited to get out there and to get the hands-on experience. So we really were an asset to wherever we went. And as far as patients, I think it was a really positive experience because they were able to get that one-on-one experience that a nurse wouldn't necessarily be able to spend the whole day with them. A student was there for them all day, no matter what.
For providing professional development training to better integrate primary and behavioral health care at safety net clinics in the region, Dr. Avtar Dhillon is honored. His work both builds capacity among providers and helps decrease barriers to care for members of the community.
What we have found over the years, there are many patients whose medical needs are worsened by the not getting proper care of the mental health. So the purpose of the training was basically to work with the primary care clinicians and to provide them the training in the mental health so they can evaluate these patients. And there are many disorders they can treat in their office, and there are others which they can't. Then we can coordinate the services.
Dr. Dhillon's leadership style has been very collaborative, particularly with this project, where we got our information that we needed about what training was required from the clinics themselves. So one of the things we're really proud of is that Dr. Dhillon was able to take that feedback and translate that as we move forward into a curriculum.
To be able to either treat the patient within the clinic or also to refer them out if they need care in other places has been so valuable, and I can't think of a single training that Dr. Dhillon has done that we haven't been able to take back and use at our clinic. In fact, the last training he did, we were able to use the information he had given us that same night.
Through that training, I felt more comfortable treating some of those problems and knowing when maybe it was appropriate to refer. So I felt like I was able to give better care because of the learning sessions that I attended. And also I was able to share what I had learned when I went back to the practice with some of the other providers who had not been.
He has certainly brought us together. I think we've always collaborated, but I think with his encouragement and also with the trainings and the assistance that he's given us, it has really empowered us to work together and to mobilize some of the community resources that we weren't using before. And I think that is huge.
Research has come out and says the life expectancy of individuals with serious mental illness is at least 25 years less than that of the general population. So there's a great deal of health disparity involved. And so the more we can train, the more we can cross-train one another, the more we can integrate care, the better health care we can deliver to the seriously mentally ill population, increase life expectancy, and help them be contributing members of society.
Williamsburg Health Foundation is proud to honor these healthcare heroes for their leadership in increasing access to care for our community members and contributing to a highly trained healthcare workforce.